Hi, I'm Gary Vogel, President and founder of Bayside Home Care. One of the common questions that we get is what's the difference between home health and home care? So let's talk about it real quick because it can be confusing. And some people don't even know if there is such a thing as home health and home care. So, home care is where a caregiver may come into the home, maybe a few hours a day, up to 24 hours around the clock care. And they're going to help with personal assistance items like bathing and dressing, making sure that the client is staying clean and comfortable with like incontinence issues, that kind of thing. We also provide errands and transportation. Perhaps the client needs to go to a doctor's appointment, needs to get their hair done, wants to meet a friend for lunch or go to a movie. Provide quite a bit of transportation. When they go to the grocery store, just get them out in the community where they love to be and don't feel so isolated at home. They're obviously a big part of what our caregivers do is meal planning and preparation. So we're making sure that our clients are getting good nutrition so their immune system is staying up. Light housekeeping, keeping the home tidy, making sure the laundry's getting done, the sheets are clean, the bathrooms and kitchens are clean, vacuuming and dusting. And the biggest part and benefit of home care is the connection with the client. Our caregivers are in this business because they have a heart to care for the elderly. If they don't, we don't hire them. That's simple. You got to have a heart for the elderly to be in this business. Otherwise, you're probably not going to last long and you're not going to be a good caregiver. So that rapport that these caregivers build is really important to them. And it's also where the client is hopefully looking forward to seeing that caregiver on the days that they're scheduled to be there. Now, home health is skilled care services like an RN perhaps coming in once a week. Maybe there'll be an aide come in maybe two times a week, or maybe an hour or two to help with bathing. They're also going to be providing physical therapy, occupational therapy, perhaps wound care or speech therapy, a lot of great services that home health provides. Home health services are going to be provided and paid for by Medicare, usually, and insurance, where home care is usually an out-of-pocket expense. Perhaps the veterans benefits may help pay or long-term care insurance, but probably 95% of the time it's going to be an out-of-pocket expense. So those are the two biggest differences between home health and home care. But what's really great and what's really beneficial to the client is that if the need comes for home health and working in conjunction with home care, they can remain at home safe and healthy for a very long time. So that's a real quick overview of home health and the difference between that and home care. Thanks for listening. Have a great day.